Yeah, from our last episode, I would like to continue with the signs or the warning signs that shows you have blood pressure, that is high blood pressure. The commonest or the frequent symptoms that makes you know that you have a high blood pressure is headache, frequent headache. You start having unexplained headache. You need to go and check your blood pressure. You are likely to have an high blood pressure. The second one is blurring vision. If you have a problem with vision, it's not only hypertension that can make a patient to have blood vision. There are so many other medical conditions that can make someone have a blood vision. But some of those signs and symptoms of hypertension are also blurry vision or sight impairment. Another one is dizziness. If you start having dizziness, it's not only specific to high blood pressure alone, but it's one of those major signs of hypertension too, apart from headache. Epigastric tenderness, that is chest pain. You start having chest pain, unexplained chest pain, you might be suffering from hypertension. If you have shortness of breath, that's difficulty in breathing, that might also be another sign of hypertension. And we call something exceptional dyspnea. That is, if you are walking, you are doing some physical activities and you start having difficulty in breathing, it might be as a result of hypertension as well. Difficulty in moving from a long distance, before you know it, like maybe before moving from one pole to the other, you start feeling excessive tiredness. That's another signs of hypertension. And it's even possible you might not have any of those symptoms and your blood pressure will still be high. You can be an asymptomatic hypertensive patient without even seeing any physical signs or symptoms in your body. Those are those one with silent hypertension, and it's a very bad one. Depending on the stage of the hypertension, it might come with pedal edema, like swollen feet. In some patients, they might have swollen feet, depending on the stage and the progress of the hypertension. Some of them might even have difficulty in urination or scanty urination, depending on the progress. If the hypertension has already damaged the kidney or impaired the function of the kidney, you might have some of those things. There are some other, depending on the parts of the body that the progressiveness of that high blood pressure has affected. That will now determine the symptoms. But the basic major common symptoms of hypertension are headache, dizziness, shortness of breath, excessive tiredness, and unexplained